Hello, this is Dr. Steve Tyring in Houston, Texas. I started prescribing KLISYRI when it became available after having done the clinical trials that were published in the New England Journal of Medicine last year. And in those trials, we saw a good rate of clearance of the actinic keratoses, good compliance by the patients, and based upon observations in the trials, we started prescribing it as soon as it became commercially available. Patients that benefit most from KLISYRI are those that have more than just a couple of AKs. So when they apply the 5-day course of KLISYRI, usually by the 5th day they will have some erythema, but if they have any pruritus or discomfort, it's usually quite mild and well tolerated. So by the 5th day, they've completed the course and are usually very compliant. And when they come back, the majority of their AKs have cleared, and patients generally are quite satisfied with the results. When any fellow dermatologists who haven't prescribed KLISYRI ask me about my advice for treating AKs, my recommendations are to use field therapy for those patients that have more than just a couple of AKs. And with KLISYRI, after 5 days, the patients will have usually demonstrated good compliance, and they will usually see a high rate of clearance. So good compliance, good results in the short term, and good results in the long term, all the reasons that I recommend KLISYRI to my patients for field therapy of their AKs.
Indication: KLISYRI is a microtubule inhibitor indicated for the topical treatment of actinic keratosis of the face or scalp. Important safety information, warnings and precautions, ophthalmic adverse reactions. KLISYRI may cause eye irritation. Avoid transfer of the drug into the eyes and to the periocular area during and after application. Wash hands immediately after application. If accidental exposure occurs, instruct patient to flush eyes with water and seek medical care as soon as possible. Local skin reactions. Local skin reactions, including severe reactions, erythema, flaking, scaling, crusting, swelling, vesiculation, pustulation, and erosion ulceration in the treated area can occur after topical application of KLISYRI. Avoid use until skin is healed from any previous drug, procedure, or surgical treatment. Occlusion after topical application of KLISYRI is more likely to result in irritation. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 2%, were local skin reactions, application site pruritus, and application site pain. Please see full prescribing information.